Hello, guys. Welcome to my educational platform. I'm glad you showed interest for my webinar about the injectable technique. Today, I will try to share with you some clinical tips about injectable technique for the production of composite veneers. I will try to give you the idea to think out of the box how you can very nicely and also in predictable and precise way reproduce great morphology of your future composite veneers, like for example, the one shown on the slide. My main key idea will be simplicity because I'm a simple guy. I'm trying to follow some simple procedures to have simple protocols, which will give me great aesthetical and functional as well, but long lasting result. I'm still a young dentist and I'm fascinated by all different uh, kinds of dental procedures, the implants, ortho, periosurgery, ceramic, composite veneers, you name it. When I'm in clinic, I'm feeling like a little kid playing in the sand. But my manual skills are maybe not on the highest level yet. But like this girl, somebody taught her how to fill this bucket with wet sand to reproduce great morphology. Okay, she doesn't know much about statics, about the architecture, about sculpting. Her manual skills are on low level, but with this copy pasting or molding technique, she was capable of reproducing this great morphology. The same thing I will be showing you today, how to get from, for example, this clinical situation in this one in very predictable and precise way. And trust me, all of you who are watching this, if you had the same patient and if you had the same transparent silicone I used for this case, you would get the same aesthetical result. I hope I caught your interest. Let me introduce myself. My name is David Gestakovsky. I will be speaking today about resin composite injectable technique, about the clinical procedure of this technique in the production of composite veneers. Today we will be speaking about the anteriors, about veneers. Regarding this technique, I'm working with it more than 5 years so far, and I have some publication on this topic. The two of which I would point out are the one from Quintessence International from 2019 and the one from International Journal of Aesthetic Dentistry. Both of them are uploaded on my educational platform, which you can find the link in the bottom of the slide, www.injectabletechnique.hr, where you can read those articles. What's interesting about this Quintessence International publication is that actually this case was done by me when I was fifth year student. I wasn't even final year student when I did this case, but since the technique gives you predictable result, it was good enough for Quintessence to publish it. Okay, so this gives me idea that all of you who start working with this technique tomorrow will get even better results. And today I will show you those cases. In the past 5 years, I've been lecturing on this topic on congresses. More than 2 years ago, I started with online masterclass project where we had more than 100 events and more than 300 participants of this online education, which has two webinars and lasts for 8 hours. Today, I will try to compress it with main informations for you to maybe start working with this technique. We're organizing regularly webinars, hands-on courses, different demonstrations, but also private clinical courses. If you want to organize hands-on course or private clinical course in your clinic, in your city or country, feel free to contact me later on. We already have scheduled courses worldwide, as you can see on this map. So, a short introduction about this technique. The name is resin composite injectable technique or flow injection technique or injection molding technique. Those are all synonyms for the same thing, for the same technique, or better, let's say, for the same concept. Okay, here we need to have suitable patient with indication of placement composite veneers We need to have well-prepared wax up, which can be analog or digital, whichever protocol you are usually following. We need to make transparent silicon index based on this wax up, and to make small holes inside on the incisal edges through which we are later on going to inject flowable composite directly in the mouth of the patient, directly on the teeth, and then light cure. That's why we need to use transparent silicon index. So basically, this is kind of indirect, direct technique, because we are planning everything indirectly in the lab, in the articulator, of course, and later on delivering those veneers directly in the patient's mouth without any preparation. Today I will try to give you closer insight in clinical protocol of this technique, but basically if you catch those photos, you will realize the protocol is the same like for any other composite restoration. We need to etch, we need to isolate, we need to bond, we need to apply composite, light cure, and then to do finishing and polishing. The only difference is that the appliance of the composite is in a different way, following different ideas. Here, we are injecting under pressure flowable composite in the space of the mold and totally copying our wax up directly in the mouth of the patient. So this is the case from International Journal of Aesthetic Dentistry. Today I will be showing you a case of one lateral incisor. First, we need to fit sitting of our transparent silicone to be sure everything is ready before starting to prepare enamel, to etch. So this is our guy for today, perfectly indicated for injectable technique, because we just need to add some volume to the tooth. We need to make it wider, longer, thicker, or whatever. First, we're starting with the isolation of adjacent teeth, because I don't want to have etching gel on them, because they're not going to be covered with composite. So for the isolation, I use Teflon tape on adjacent teeth, and I'm covering the whole dental surface with etching gel. Now, you can prepare your enamel in three ways. By prolonged etching time, this is what I do mainly these days, to etch for 60 seconds. Or you can do the sandblasting with 30 or 50 microns aluminum oxide on high pressure uh, to remove the surface layer of the enamel, to do the micro preparation. This is also an option. Or you can use some rough disc to roughen the surface. Okay, the idea is to open the prisms, because we are doing everything on unprepared enamel, on intact tooth, and as you know, on the surface layer is aprismatic enamel, and the bonding strength is higher on prismatic enamel. So we want to open those prisms. Me personally, nowadays I just prolong the etching time. Then we need to rinse everything, but also to dry it out. This is not something that we want to see in our mouth. This is just one artistic photo for a webinar, but actually this is what we are trying to read, the dry field of work. So I'm using Optragate or other lip retractions to retract the lips, but I'm also placing small cord in initial part of the sulcus. Okay, something like this. First thing first, patient is lying or laying in my lap. Okay, working everything on 12 o'clock. So all saliva goes down the throat. We remove the lips with retractor, but also I'm covering adjacent teeth with a Teflon and placing the cord in initial part of the sulcus. In most of the cases, I use a cord. In some situation, it's not possible, so it's not mandatory. This is one of a few modifications that I describe in Quintessence International publication, and I will try to share more of those modifications with you today. I'm using some regular dental cord, but placing it in initial part of the sulcus, not too deep, not to retract the gingiva, but to make barrier in between the external and internal part, or the sulcular part. Now you will say, but the cord is hydrophilic. It is, but once the adhesive covers the cord and you light cure it, it becomes a real barrier, and there is no more sulcular liquid coming out or composite coming in the sulcus, because the main idea is to prevent fluctuation of flowable too deep in the sulcus. This is the purpose of the cord. Then we do regular bonding procedure, drying out, letting to swell, and then do light curing, and then we're ready to go for the injectable part. Here we have transparent silicone, which is cut following gingival margins. Don't get confused with this curvy line. This is just the impression tray line, but actually transparent silicone is cut following gingival lines. This is also one of my modification about this technique, because I want to have my margins or the edge of the silicone index following my margins. So after the injection phase, I can inject more than enough or more than is needed. So on the all marginal part, composite overflow the margins. Then I do short light curing for 3 seconds. And after, I remove all the excess from the margins in very easy way with a probe, with a scaler, with scalpel, whatever you wish. After that, we are going for final light curing for 40 seconds from vestibular, 40 seconds from incisal, and 40 seconds from palatal. Here I'm doubling the time of the exposure to the light, not because the silicone is not clear. It is totally clear, and the light goes all the way through it. But because of this transparent silicone, we have some barrier from the light to the composite. And as you all know, with the bigger distance, the power of the light curing lamp is decreasing. So to be sure everything is well polymerized, I'm doubling time of polymerization. Now, this is how it looks after removal of transparent silicone. You would say it maybe looks a little bit rough. The margins don't look nice, but it is because we use the cord. After we remove the cord, we'll be able to feel where is the margin of our composite. And if we can see it and if we can feel it, we can also polish those margins. This case was done many years ago when my technician was printing models on a regular printing mode, so you can actually see those layers of the printers. Nowadays we're printing on superfine printing mode, and the next thing that I want you to have to understand is check the amount of the excess. It is almost no excess because the adjacent teeth are in full contour. I'm calling this single veneering concept when there is no empty space on adjacent teeth, where the excess of the flowable composite can flow, because sometimes the excess of the flowable adjacent can be a problem. I'm always trying to follow single veneering concept, and in masterclass I am explaining in multiple veneers how you can make this single veneering concept in analog but also in digital way. When following single veneering concept, you have small amount of the excess on interproximal surfaces, as you can see here, but it is very easy to remove it. You can just place some non-cutting metal stripes in between the teeth and start scratching with scalpel blade number 12. If you ever watch a Squid Game, or you know how they are cutting the glass with the diamond knife, and then just punch it and it broke perfectly. This is the same way how we are going to remove our small excess from interproximal surfaces. Here, if you touch it with a burr, most probably you're going to destroy the perfect convexity of your veneer, which was planned by your technician. We are polishing margins with some fine diamond burr on low RPM in electric handpiece. I don't use turbine or fast handpiece. Electric handpiece because you have better control, lower RPM, and without water cooling, because you're not going to overheat the tooth. You'll have better visualization what you're doing. But I'm advising you to use some Heidelman spatula or some gingival retractor to protect gums and gingiva while polishing. You can also use this EVA handpiece, which can get the cones inside that makes those two-dimensional movements to polish margins to gingiva because it doesn't have cutting edge, so you cannot harm the gums, but you can nicely polish it. If you don't have it in your office, it's not a problem, but it it is useful if you have one. Back in the days, I used some fine carbide to polish the vestibular surface. Nowadays, I do only super fine polishing because after the injection phase, my primary and even secondary morphology looks stunning, and only I need to do the fine polishing till the high gloss. So, for example, nowadays I almost don't use diamond polish or rubbers. Regarding interproximal surfaces, you can use some fine metal stripes just in and out. With this, you're not going to open the contact because when you place it inside of the tooth, since teeth are slightly movable inside of the socket, you are going more to open the contact and just do fine polishing. And later on, you can help yourself with super fine stripes like the Epitex from GC, the one in the photo. I'm using blue one and green one, but have in mind to use the S formation, okay? The S moves in this way. You're not going to open the contact point, you're just going to polish part of the interproximal surface. For example, if we are polishing canine here in this slide, we would be polishing more vestibular part of interproximal surface, and with this S motion, we would be polishing more palatal part of interproximal surface. For the final gloss, I'm using a Softlex spiral from 3M, the brown one and the pink one. One has aluminum oxide, the other has diamond particles. Uh, those one in combination with polishing paste later on after I'm using them without water heating on low RPM, and later on polishing paste with the buffer or cotton wheel like the one in the photo will give you stunning result regarding the gloss of your restoration, like in the veneers in this case in this photo. So all from canine to canine in this photo, everything is covered with the composite, and you can see the amount of the gloss that you can achieve. So this is our lateral incisor after the treatment. Actually, it was next day after the treatment. There is still some redness around the soft tissue, but later on everything went fine. This was a very challenging case because we needed to include the new teeth, the new veneer in existing dental arch and to match with proper shade and proper morphology. But if we have good technician and skillful technician who understand what we are doing, and if we understand shading of composite, how to match shade perfectly, it is possible to match it nicely, as you can see in this photo in existing dental arch. This is before and after. This was done, I think, 3 years ago. So, and I'm always on my online masterclass trying to show you the follow-up photos as well. This is from different point of view. As you can see, it is totally the same like the one on the right side. Uh, could we get better result if we used ceramic here in this case? I don't think so, because here everything matched in perfectly, shape and shade as well. Why I'm showing you this photo? This is actually cover from my International Journal of Aesthetic Dentistry publication, and as mentioned, you can find it on the link below on www.injectabletechnique.hr. On our educational platform, you can read both of my publications over there, where you can find the whole clinical procedure written in the PDF file. Now, let's discuss the indications and which cases are suitable for this technique. For me, things is very simple. All of the cases that you will find on my educational platform, you can have a look over there. Some cases which are covered with the clinical photos of the real cases, all cases that you can find on my social medias or on my lecture or in this webinar. All of them are done purely additive and minimal invasive. By purely additive, I mean without preparing of the tooth. We only add composite on top of original dental morphology. So is it non-invasive or minimally invasive, depending how we are going to look at it? Because of course, we're going to add the tooth, we're going to place the adhesive, and this is some kind of microscopic trauma for tooth, and we cannot remove it without touching the tooth. But comparing to some minimally invasive ceramic veneers with 0.3 0.6 preparation, this is much less invasive. So basically, whenever we have a chance to add material to improve smile of the patient, those cases are indicated for injectable technique, such as some diastemas or conically shaped teeth, where we need to add some material on mesial, distal, vestibular, and incisal aspect of the tooth. Peg laterals are great cases. This is the case that I already showed you, and you saw how nice result can be achieved. Of course, some wear cases can be done, but we need to respect the function. I don't want to go too deep in the function in this short webinar, but first we need to understand the function, to have proper functional guidances to avoid any parafunctions, and then we can go for the aesthetic restoration. Have in mind that the longevity of composite, and this is what studies show, that the longevity of composite veneers is not so related to material that you used, but to the presence of parafunctional movements and proper functional guidances and proper functional plan. You can also use, in a case of some small misalignment of the teeth, to make a better curvature of the patient's smile line or upper dental arch. In cases of retruded teeth, of course, we can just add some composite to recontour this maxillary arch in perfect way. And now, as I told you, I've been practicing this technique for quite some time, and in my online masterclass, I'm trying to show you also different things, how I developed from more than 5 years ago when I started till today. I'm always trying to show you follow-up photos of 1, 2, 3, 4. Soon we'll have 5-year follow-up photos from Quintessence International publication. Most probably, since this is a recording, if the April of 2022 is past, we already have 5-year follow-up photos. So this was from where I started. Then next year, I tried to upgrade my skills with some micromorphology over there. This is from 3 years. 2 years ago, we implemented some more different approach to recreate perfect natural morphology. Last year, the case from the last year, although 1.5 years so far, maybe 2 years almost, but also case from the last week. So I'm trying all the time to update my my online masterclass. So far, we are on 8 hours of educational material, more than 800 photos, 20 clinical videos, 50 sketches, more than 15 cases with up to 5 years follow-up. So we're covering everything about the injectable technique over there. For example, some simple single shade cases like this one. I'm showing you how you can achieve or trick the eye and achieve polychromatic effect with single shade veneers. This is done with single shade, the lateral incisor and canine, but also how to recontour the function, because as I mentioned, the function is the key for longevity of your veneers in very predictable and precise way. As mentioned, you're planning everything in Articulator, and you can plan everything perfectly, and then just to copy in the patient mouth. How to recontour the smiles with super thin veneers. The greatest part that here you don't have the minimal thickness of your restoration, because it's going to cover over the tooth and bond directly on the dental surface. For example, in this case, where we got very nice morphology, I would say, and a nice reshapement of the smile with only 3 veneers, The thickness of those veneers at the thinnest part were less than zero point 0.1, which is stunning. Okay, and those veneers 3 years after the treatment are still imperfect condition. So yes, we are capable of just reshaping the teeth without making them too bulky. Have in mind not to make too bulky teeth; they will not look aesthetic. Okay, with injectable technique, when you're injecting, flowable composite will fill all those spaces in the mold, even if it is very thin, and you can get great aesthetic results. Where cases I told you can be done also very predictably, but we need to think about function before everything. If you don't have proper function, your veneers are not going to last. Most probably you ask ourselves, and I know all of your questions because I'm running this case for more than 2 years. I got quite a lot of those questions. Can we do it with interproximal cavities, interproximal caries, interproximal feelings? Yes, of course. There are some rules that we need to respect without leaving some concavities uh, uh, because of the air trapping and so on. But for example, this is the case where we did it with quite a big defects of interproximal surfaces. Can we replace the old composite veneers with this technique? Yes, of course, but maybe with even better morphology. As you can see on top, we had old composite veneers which were replaced with the bottom one, which I think look a bit more natural. You also ask yourself, but can we combine different shade? Can we do polychromatic veneers? Of course, there are different tricks, actually four different modifications that we are practicing on hands-on courses and speaking about on online masterclass, how you can combine different shades to recreate more natural appearance of your veneers. This is 20 months follow-up of this case, and here, for example, you can see the transparency of the incisal edge, which was nicely delivered to this patient. This is the case from Quintessence International. This is one of the actually the oldest, not the oldest, the longest case that I'm following. Uh, in 2 weeks, we will have 2 weeks from March. We will have 5 year follow-up session. So this is before the initial situation, and this is on 4 years follow-up. 4 years after the treatment, those veneers are in great condition without some clinical visible wear. We can always have some microscopic amount of the wear, but is it clinically relevant or is it visible? This is another topic. No stainings of the margins, no chipping, no wear. So basically, patient is very happy, and hopefully, he will have them for the next 5 years. Can we close diastemas? Can we treat some microdontia? Yes, of course. All of those are great cases, which I'm covering in detail in masterclass. How to treat, how to plan, how to design your wax up, and later on how to make your transparent silicone base on top of it. You can do total smile reconstructions with less veneers. This here there was only 3 veneers, but you can also do 10 veneer cases. You can do oral rehabilitations, plan everything, and then just to deliver with the injectable technique. The idea is to copy your planning from the wax up. Have in mind that your final result is totally or your result cannot be better than your wax up. Okay, so you need to find great technician who will deliver you great morphology, and then you can copy it in your patient's mouth. Sometimes I'm repeating mock-up for 2-3 times until I'm perfectly happy, and just then I am going for the final treatment. It's not technique itself that will give you great result. It is your planning or your technician planning and modeling. But later on with this technique, and I will try in the full masterclass to give you more tips and tricks how you can achieve it in the fastest way with the less problems, avoiding all possible mistakes which are on your path. Regarding material, as I told you, the most important material for this technique is transparent silicone, because this is the tool that we use to inject our composite and place directly in the patient's mouth. I'm using the ExaClear from GC because it is super clear and you can see everything through it. And in case something went wrong, because sometimes it will sometimes you can face the problems. If you can see through the transparent silicone, you can fix them immediately or avoid them even better. Um, People often ask me, David, if I join your online masterclass, will I need to buy some specific equipment to invest more in something fancy, softwares or equipment or whatever? So, what are the main tools which are needed for the injectable technique? For me, it's 3H concept. Is the same concept that I'm following for my clinical work, where H doesn't stand for Heidelman spatula. It stands for our hands, for our manual ability to work with the material, for our head, for knowing the right indications, contraindications, and to make good therapy plan, and of course for our heart, our enthusiasm towards our great great profession to deliver the best possible treatment to every single of our patients. Guys, thank you very much for your attention. I'm inviting you all to join my online masterclass, which is scheduled basically once a month on my educational platform on the web www.injectabletechnique.hr. You can find the date of the upcoming session. You can also get today pre-recorded version. The content is the same. It's just up to you if you want to join live session and contribute in the webinar with the live questions, or you want to get the access to recording, and later on you can contact me anytime if there is something you want to discuss. The full online masterclass lasts for 8 hours. It has sets of 2 webinars. Basically, in the first one, we have the introductional part. We are speaking about the literature and about the scientific base of using some specific flowable composite for this purpose. We are describing different materials which can be used for this technique, and how to choose transparent silicone and how to make transparent silicone index. Uh, we are we are going more in details about case selection, how to select your case, about the indications, contraindications, and so on. In detail, we are describing about the whole planning phase, from dental photo, impression registers, how to plan everything, to do the facial analysis, DSD, how to prepare your wax up, how to plan it, and which instructions to give to your technician. Later on, how to check it in the mockup, which things to check in the mockup, and what to improve if you see something in your mockup phase. The full production of transparent silicone index and some modifications that I bring to the technique. Uh, the whole intraoral protocol, I showed you some today. Over there on online masterclass, we're also playing intraoral videos and showing the intraoral protocol of 15 different cases of different clinical situation. Of course, about talking about finishing and polishing, how to polish till the high gloss and get perfect contours of your restoration, and about timing and pricing, because we need to know how much time we are going to we're going to invest, and also how much can we charge for it. On second webinar, we have the serial of clinical cases with the different modifications, different clinical situations, and different modifications you can use in those clinical situations, covered with photos and videos of real everyday patients, both analog, both digital, comparison, combination of different materials, ceramic, composite, so on. We're speaking about the control of the function, because this is a very, very important part about the whole longevity of of your composite veneer. So far, to knock on the wood, I didn't have any problem regarding chipping or fractures of my veneers in 5-year experience with this technique. We were speaking about saving time, how you can make your work more predictable, more easy and simple, following single veneering concept to save your time in the finishing phase. Comparing analog and digital, as I told you. And of course, I'm trying to mention most common mistakes, because in Croatia we have saying, in English people learn on Oxford, in Croatia they learn on their own mistakes. I did all of those mistakes. I know them. I know how to avoid it, or if they happen, how to fix them. And I'm trying to share with you those mistakes. Thank you very much for uh, your attention. Hopefully, you heard some new things or get the ideas for your future clinical work. You can find more about my work on Instagram page Injectable Technique Gestakovsky, on Facebook page Injectable Technique by David Gestakovsky. We can connect on LinkedIn, or you can find more tutorial videos on my YouTube channel or on my educational webpage. Over there, you have free educational content, such as trailers, how to make transparent silicon index, some how to do the mock-up, as well as this webinar. Over there, you can register for our online 8 hours online masterclass about injectable technique. You can find more information about hands-on courses, or if you're interested in organizing or in participating in hands-on courses, please contact me on the email injectable.technique@gmail.com. And you can also find different webinars on my educational platform. So far, we have occlusal stem technique 2 hours webinars. Soon, we will hopefully have more of those educational webinars. Thank you very much for your attention, and hope that we meet each other soon at some live course or live online on following online masterclass session. Bye bye, guys.